Dr. Michael Vennemeyer.
And I'm Dr. Andrea Vennemeyer, and we're here to show you how fast, easy, and affordable a breast augmentation can be. Most patients do the procedure on a Friday and go back to work on a Monday. Payment plans start at $0 down, $149 a month, and you can get approved with a credit score of 580 and up. First, we want to make sure that you're a good and safe candidate for the procedure.
Great candidates for breast augmentation are healthy, don't have any major medical issues, don't have any diabetes, don't have any history of blood clots in the legs or lungs, and have a BMI of 30 or less.
We have a rapid recovery program for breast augmentation. Most patients do the procedure on a Friday and go back to work on Monday. You just have to have a caregiver with you for the first 24 hours, and you can drive 24 hours after you're off any pain meds. Many just take Tylenol after their procedure.
To make sure that you have a smooth recovery after your procedure, you want to follow a few simple rules. One is wearing your surgical bra for 6 weeks after surgery. The second is avoid lifting over 10 pounds for the first 6 weeks. You can start working out by doing low-impact cardio at 3 weeks after surgery, and then strength training can restart at 6 weeks after surgery. You also want to avoid submerging in water to reduce your risk of infection. Although you can shower after 24 hours, you just need to stay out of pools and lakes for about 6 weeks afterwards.
Many are surprised with how affordable a breast augmentation can be. Most patients can get approved with $0 down, $139 a month, pre-approval from 580 and up credit score. You can use a cosigner if you need to, and approvals are immediate. Scheduling is easy. Simply pick your date, fill out your medical history online, text your pictures in, print out your packet that we email you. It has all the information about your procedure that you could need to know. Be sure to bring that to your pre-op visit with you.
Once we have your medical information, I'll review it and see if any labs need to be ordered for pre-op clearance. Women over 40 will need a mammogram within the past 12 months.
Any labs needed will be emailing to you. Just print them off and take them to a local lab to get them drawn.
At your pre-op visit, we'll be doing measurements to determine what size of breast implants fit your body perfectly.
We'll put special sizer bras on you and put breast implants in based on the measurements that fit your body. This part is really fun because you get to visualize and have an idea of what your volume is going to look like after your procedure. We also do your pre-op pictures, make sure that you've read through your packet, sign consents, and after that visit, your prescriptions will be submitted to your pharmacy. The day before surgery, you're going to get a text message. That's going to tell you your arrival time to come to our surgery center. Be sure you read all the details on that as it recaps everything in your packet. Be sure not to eat or drink anything after midnight the night before, and take any medications that you're told to in your packet. The next morning when you arrive, our nurse is going to greet you at the front doors, and your caregiver will be told when to come back and pick you up.
People are surprised at how easy their breast augmentation is. After I mark you, we'll get started. The procedure takes about 45 minutes to an hour. You'll be at the surgery center about 4 to 5 hours total, but you'll go home the same day. We'll call your caregiver as soon as it's time to pick you up. The evening of surgery and the morning after surgery, our nurse will call to check in on you. Please be sure to answer so that we can help make sure that you're healing perfectly.
So what are you waiting for? Click on the Get Started link now.